First, can you tell me your name and your date of birth? Some info.
Joe Smith.
Joe Smith. All right, Joe. Birthday is correct. Proper hand hygiene, done on proper PPE. Joe, do you have any spiritual or cultural considerations that I need to worry about?
No.
No? Any vision or hearing difficulties?
No.
Excellent. Are you in any pain today, Joe?
No.
What brings you to the hospital?
Physical.
A physical? And can you tell me what month it is?
August.
August. Thank you, Joe. Patient's A&O times 4, GCS 15, spontaneous eye movement, A&O times 4, and verbally responding to commands. Do you have any neurological diagnoses or symptoms like neuropathy, which is numbness, tingling in your hands or your feet, or any Parkinson's, any tremor that you're aware of?
No.
No? Okay. All right. I'm gonna take this little bright light here and shine it into your eyes, and just take a quick look at your pupils, okay? So just go ahead and stare straight ahead.
That's very bright.
I know, I'm sorry. All right, stare at the tip of my pen here. I'm just gonna bring it closer to your face. Just keep your eyes fixated on the pen here.
Okay.
Pearl is present, cranial nerve 1 and 2 intact. I'm gonna touch your face here. Can you feel me touching you?
Yes.
Yeah? Can you go ahead and smile? Puff out your cheeks. And go ahead and open your mouth. And I'm just gonna take a quick look in there. Go ahead and say ah for me. All teeth are present. Normal hydrated mouth. Tonsils don't look irritated, inflamed, or infected. Do you have any irritation in your throat when you swallow?
No.
Can you swallow for me?
Yes.
Yeah? I'm gonna put my hands on your shoulders. I would do this reality with the patient sitting up. Go ahead and shrug for me.
Done.
Excellent. Go ahead and take your head and turn left and right for me.
Okay.
All right. I'm gonna go just off to the side so you can't see me. I'm gonna plug your ear. I'm gonna whisper a couple words. Dog, cat, tree. Can you hear me?
Dog, cat, tree.
Same thing.
Dog, cat, tree.
That's very good, Joe. Very good. So that's the cochlear portion of cranial nerve 8, but we have cranial nerve 9, 10, 11, 12, facial, uvula, rose, midline, for the vagus nerve, patient swallow. I'm going to inspect no JVD evident, auscultate for Brui. None present. I'm going to palpate lymph nodes. Go ahead and swallow for me. Do you have any tenderness in your neck or along your chin?
No.
Perfect. All right, I'm just going to do a general inspection of your head as well and kind of touch your scalp. Don proper PPE here and look in your ears. Do you have any pain as I apply a little pressure?
No.
No infestations of the hair, no skin breakdown behind the ears or behind the head, no obvious deformities, and sensory is fully intact. I'm going to take a look in your eyes as well while we're here. I'm just going to pull down on your eyelid, look at your eyeballs. Sclera is white, no obvious irritation, no drainage of the eyes or the ears. Eyes are symmetric, ears are symmetric. Yeah, I'll do that both sides, obviously. So I'm just going to go ahead and listen to your heart and lungs. So this is what I would do if I were you. I would just say I'm gonna looking at me or whoever's checking you off. Aortic valve, second intercostal space, right sternal border. S1, S2 present. No murmurs or abnormalities. Pulmonic valve, right sternal border, second intercostal space. Same thing. Erb's point, third intercostal space, fourth intercostal space, tricuspid, and then we have mitral valve and apical pulse. To get an accurate apical pulse, assess for a full minute. Heart rate and rhythm is normal and regular. Do you have any cardiovascular symptoms like shortness of breath, chest pain, any swelling of your extremities that you're aware of?
No.
Perfect. I'm just gonna listen to your heart and lungs, your lungs now. So what I would do is, in this case, say, I'm gonna do 12 anterior pulmonary auscultations, identifying normal breath sounds. So I'd have the patient inhale and exhale at each of the 12 sites, alternating sides, all the way down. Normal breath sounds, no wheezing, crackles noted. And then if the bed sat up, have them sit up, just show the same thing posteriorly. While I was posterior, I would also inspect the back as well for skin breakdown. So no, the posterior, including the sacrum, is clean, dry, and intact. No wounds, abnormalities, deformities to know. So I do this while the patient's seated, upright, have them do range of motion. Just go ahead and lift your arms, and you bend at your elbows and your wrists.
Mm-hmm.
Can you feel me touching you
Yes.
here? Okay, I'm gonna slip my hands in here. Go ahead and give my hands a squeeze.
Squeeze.
Grips are equal. Strength 5 out of 5 on the grips. All right, I'm gonna have you bring your hands up here, and I'm gonna apply pressure. Just push away from your body. So I'll be applying here. Want them to do this, and then I'll do the same thing. Pull back. Strength 5 out of 5 upper extremity. Sensory is intact. Upper extremity, there is no skin breakdown, wounds, rashes, abrasions. Skin color appears to be completely normal. Per ethnicity, cool, dry, or warm and dry. Mannequin's cool. And do that on both sides. Cap refill. I would squeeze both sides simultaneously. Look at both sides. Less than 3 seconds is normal. Do radial pulses. 2 bilaterally. We got carotid brachial pulses. 2 bilaterally. Carotids. 2 bilaterally. 2 is normal. 4 is like increased or bounding. I didn't say it, but I'll say it now. Patient's affect is appropriate, demeanor, they're responding appropriately, they're speaking clearly, no coughing, so I know airways patent, and just mentioned circulation, also nares patent, no drainage. What was that? So we did some skin. I would do respiratory rate also for a full minute, noting regularity and breath sounds as well. I'm just gonna expose your abdomen just for a second here. Any difficulty moving your bowels or bladder?
No.
Perfect. I'm just gonna do a little auscultation, starting in the right lower quadrant. Listen for about 30 seconds. Moving clockwise, bowel sounds are normal, active. All right, Joe, I'm just gonna apply a little pressure to your abdomen. Just let me know if it's painful or anything, and I'll stop. So a little pressure here. Any pain as I apply pressure?
No pain.
And as I release, any pain? rebound tenderness, and I would do that in the same 4 quadrants. Palpate for distended bladder. No distension noted. Any questions up through this point? So you see I'm not following the sheet. But do you. Alright, cup your belly up. Just gonna expose your legs here. Any pain as I apply low pressure working my way down?
No pain.
No discomfort? Can you feel me touching your legs and your feet?
Yes.
I'll be inspecting the skin. I don't wanna pretend the leg's exposed. Inspecting the skin anteriorly and posteriorly. No skin breakdown, wounds, abrasions, or deformities. Calf size is equal bilaterally. Edema, 1 graded bilaterally. I didn't inspect the abdomen. It's round, no deformities, scars, or anything like that. I'm gonna do pedal pulses, posterior tibs, 2 out of 2. Is popliteal on yours, on the sheet? Yeah? I see yes and no. Okay, that's behind the knee. I couldn't remember if it was on your sheet.
No, behind the
Sorry. So I'm just gonna have you slide your ankle. You can do this in the bed or out of the bed, however you want. This is just range of motion. Slide your ankle up towards your bottom, but keep your foot on the bed so they'd be bending at the knee and the hip there. We're just looking at range of motion. Do that bilaterally. Good range of motion, upper and lower extremity, good sensation across the whole body. I'm gonna put my hands under your feet. Go ahead and push down like you're driving a car, pushing the gas pedal. Okay, now on the top, lift up, bring your toes to your face. Excellent. So, bilateral lower extremity strength, 5 out of 5. We can do cap refill while we're down here. 3 out of less than 3 seconds, which is normal. Edema, skin, clean, dry, intact, color, normal. Skin turgor, one I missed. You can technically do it on the foot, but normally on the back of the hand. Just pinch the back of the hand there. Make sure there's no tinting. So you just say no skin turgor negative. JVD should be with head of bed elevated as well. Like I said, 30 to 45 degrees per the rubric. All right, Joe, I'm just gonna have you sit on the edge of the bed here. We're gonna go nice and slow. Any problems moving quickly? Have you ever gotten dizzy when you move fast?
No.
No? Okay, great. So have them swing their legs over, get their bearings straight, have them stand up, and at that point, that's where I would do rotator drift. Looking for rotator drift, so I'll say, go ahead, put your hands out in front of you, palms facing up, close your eyes, go ahead and stand, and we negative for pronator drift. Romberg test, keep your eyes open as you're standing. Now I want you to close. I should probably do that first. Their balance assessment, so that's their vestibular portion of cranial nerve 8. Alright, assuming that's all good, I'll have them do a gait assessment. Just do a quick walk, symmetric, no jerking, shuffling of any kind. I feel like I'm missing some stuff. Now that we're standing.
Touching your nose.
Oh, coordination, yeah.
Chest symmetry.
Yeah, inspection of the chest. I didn't expose the chest. I know I didn't do that.
Do you check pressure points, skin pressure point breakdown?
So
Is that
if
all
you
the
if
same?
you make sure that they can move, like the color, warmth, movement, sensation, if you do that and you're saying I'm inspecting this skin, to me that's encompassing. And I know I did coccyx, but and I said no breakdown on the back of the head, so that's another point.
Did you ask if he was in pain?
That was one of the first things, which Ashley, you were asking me that, right?
Range of motion in arms.
Yeah, I did that.
Did you do the crisscross for that?
Ooh, Cardinal's gaze, I didn't do that, yep.
Oh, yeah.
Which you're in their face quite a bit, so that's one that should be kinda easy to remember to do. Yeah, that's cranial 3, 4, and 6.
Your tongue, you did
Didn't have them stick it out and move
Stick
it,
it outside
yeah.
his arm.
Yeah, if you like on that list for if you do the vast majority, you're capturing a lot of it. But that's hypoglossal, so. So you, it was?
like 16.
Was it really?